Recording is started. All right. Christy, over to you.
Thank you so much, Marissa. So thank you all for tuning in. We really appreciate your participation today. We have an exciting webinar for today's discussion, hosted by Miss Joy Jacobsen. I do want to shout out to the new name and brand, as you can see in Marissa's left corner, the National Association of Doctors in Public Health. So we are a 3-year organization that has been moving and grooving for a while, building policy initiatives around building doctors of public health professionals, doctors of public health students, and also just advocating for new initiatives around bringing more doctor of public health professionals into the public health workspace. So thank you all for tuning in, joining us. I am Christy James. I am your Career Development Chair, bringing all things career development to NADrPH, along with people like Joy to give us wealth and knowledge. So without further ado, I'm going to introduce Joy, who is a forward-thinking public health leader deeply committed to promoting health equity through her extensive career spanning over a decade. With a strong focus on epidemiology, she has made significant contributions to the betterment of communities. Her professional journey includes serving in epidemiology roles at 4 distinct health departments and an LGBTQ federally qualified health center. Through these diverse experiences, she has honed her expertise in epidemiology and actively worked towards improving the well-being of underserved populations. She recently achieved a huge milestone. If you have not seen the webinar before, please check it out. The one we just had about 2 weeks ago around her public loan forgiveness, but she achieved having $100,000 in student loans forgiven, huge milestone, through the Public Service Loan Forgiveness Program. Her journey through this complex process has equipped her with valuable insights, and she is eager to share her lessons learned about loan forgiveness and today, public service with others. So without further ado, Joy Jacobsen.
Hello, everyone. Thank you so much for having me today. Sorry, I'm at an awkward angle. iPad issues. I'm going to go ahead and share my screen. Okay. So today I'll be talking about the pros and cons of public service. A little bit about myself. My name is Joy Jacobsen. I'm currently the senior epidemiologist at Santa Barbara County Public Health Department. I've been in that role for about 5 years now. Prior to that, as you heard in my intro, I was at Sonoma County Public Health Department, Seattle-King County, City of Chicago, and a clinic in Chicago. Just want a full disclosure here that all the opinions I'm expressing are based on my experiences. You might have different experiences. But wanted to share what I've learned working in public service, which is defined either as government, could be federal, local, state, or working for a nonprofit, which has been my entire career. So first, I'm going to talk about the benefits of public service, and there are lots of them. Careers in public service can be really rewarding. I know you're all here today because you're exploring or in the process or have already completed an advanced degree in public health. And careers in government working in public health can be really great. You're giving back to your community. You're serving a critical role. And a lot of us went into public health indeed to have that community engagement, to work on policies that improve health conditions of those that maybe we come from that same community, of people who traditionally have not been served well by health systems. So public health in government can be really, really great. And I think a lot of the work is value driven and matches up in alignment with our professional goals. Much of public health, of course, occurs in government, as many public health departments are either local, state, or federal government entities. There's also really great nonprofits doing amazing public health work. So if you're interested in public health, working at a government agency makes a lot of sense. And there's a really great history of public health. There's also, some not so great moments, but certainly if you're interested in public health, working in one of these sectors makes a lot of sense. Another benefit is that most government work, you will have a pension. And pensions are pretty much the best retirement option we have in this country. It's automatically done for you. So rather than having to figure out how much money you want to take out of your paycheck to put into a 401k, this is done pre-tax for you, no thoughts about it. And most pensions give a pretty good reward to people who stay in the system long enough, and pensions can be shared across different organizations. So for example, I'm in the state of California. We have a pension system called CalPERS. It is shared amongst all counties in California, pretty much, with a few exceptions. So even if you're gonna bounce around, you still might be in the same pension system. They have what they call as reciprocity. Pensions also have surrender benefits. So this is a way to build generational wealth, which most people don't think about, but we're really interested in not only building our wealth and being able to retire, but also, of course, passing something on to our next generation. And pensions have that benefit. So that's a really great system as well. Sometimes it can be hard to learn about different pension systems and exactly what your benefits are going to be. So I would encourage you, before you apply to a job at a government agency, ask the name of the pension organization, follow up with them, learn how much you have to put in, learn what percentage your government entity is going to put in, learn how long you have to work there until you're eligible for retirement. My pension system has a calculator. So it'll tell you, the county currently puts in about 8% a year. And at that rate, I could retire in 15 years. But I'm not eligible at my age. I have to wait until I'm older. So this is a really, really good reward for working in government. And most people I know my age don't have nearly as good of a retirement package, because when you're struggling just to get out of school, and paying off your student loans, and maybe you don't have as good of a salary as you're going to get in a few years, it's hard to put money away. It's hard to make that investment in the future when in your current state, you need that money right now. With the pension system, it's automatically put away for you. So you're investing in yourself the day you start working in government. Also, if for whatever reason you decide to leave government and your pension does not have reciprocity at your new job, you can either keep that money in the pension and it'll continue to be invested and grow, or you can take that money out and put it into an IRA for no penalties. And again, just continue to build that wealth. Or you can cash out the money. They do charge you for cashing out. You get taxed at a higher rate. I believe it's a 20% tax penalty for removing money out of what would have been a retirement fund and taking it. But if you need that money, I know I've done that in the past because, as I'll talk about in a moment, I've had to move a lot for my different jobs, and I needed that money to afford to be able to move to a different state. So, it is your money. You're gonna get it back. You have to stay a certain number of years. In my case, it's 5 years in order to be vested. And what that means is the money that the government is putting in towards you, that 8% for me, I get back. If I leave before I'm vested, I only get the money that I put in. But you're pretty much not going to lose money putting it into a pension, assuming your pension system is financially responsible, unlike a 401k, which my parents did and lost a lot of money as stock markets varied over time. So another good thing is the government has a lot of perks. We get all the holidays. My husband works for a private company and I get, 5, 6 more holidays a year than he does, including upcoming Veterans Day, for example. All government gets off. So that's one perk. Another perk is, in general, your health insurance is going to be really good. I don't pay a monthly premium for my health insurance. So it doesn't cost me anything out of my paycheck to get health insurance. I only pay copays, deductibles, all those normal stuff, which is relatively low. My deductible is 1/10 of what my husband's is. So there's lots of really good government perks like that you're gonna get working at a local, state, or federal level. And of course, you qualify for public service loan forgiveness. You do have to be in a qualifying payment plan, making payments, and working full-time at least 30 hours a week total in your government or nonprofit for 10 years. But you do qualify during that time. It does not have to be consecutive. So that's another really, really good benefit to potentially get rid of 6 figures of loans, as I did after working 10 years in public service. So next, I'm going to talk about some drawbacks. One is compensation. So depending on what you want to do with your degree in public health, you might be able to make substantially more money in the private sector compared to working in public service at a nonprofit or a government. In my case, in epidemiology, I can tell you government pays a lot better than nonprofit for epidemiologists. But there are some nonprofits, depending on what your title is going to be, you could make more money in nonprofit than government. It really depends. But certainly for me, working at a pharmaceutical company, I could easily make 60% more than my average salary working in government as an epidemiologist. So compensation is one thing. Also, when thinking about compensation, thinking about the total package. So working in public service, I've never gotten a bonus. I have gotten cost of living adjustments, or COLAs, which are between 2 and 5% usually, which you barely notice in your paycheck, right? So little after taxes and everything. When I've had to move for a job, I've never gotten any money to help me in those moving expenses. Those have all been out of my own pocket. So that's another thing to consider. I've never gotten stock options, which some private companies offer, which can be quite lucrative over time, depending what kind of company you're at. So those are just the compensation things to keep in mind, which in government you're going to have limitations on. Another thing is that advancement in government can be challenging. And I say this because sometimes there's not a clear ladder for you to advance in government. Sometimes there is, but oftentimes there isn't. In addition, most government positions are unionized, and the union sometimes makes it hard for newer staff to advance over staff that have been there for a very long time. So I had that experience, not at my current employer, but at a different employer, where there were a lot of people who had been in the same title that I was in. And even though I had a different skill set, even though I had different knowledge, even though I had different education, the union doesn't care, right? It's your title and your longevity that matters. And it makes it very difficult to advance over people who have been there longer. So that can be a challenging feat. Also, public health and government sometimes doesn't have good support for newer staff to learn new skills in order to qualify for advancement. So for example, if you come into a position and you're not a supervisor or manager, it's going to be very hard to excel to one of those positions if you don't have that experience. And you can't get that experience because according to the union in your current job, you're not allowed to do those duties. So that can make advancement additionally challenging. Professional development, it depends on where you are. Some government positions, some nonprofit positions have really great professional development and invest in their employees. Unfortunately, I've seen a lot of times where this is not the case, where employees are not given the time or the compensation to go to national conferences, to take that new course on how to use AI in their job. And so people end up with a lower skill set over time because they don't get that investment back in themselves. You can try to work around this. There are lots of either low cost or free resources, I'm a big fan of, adding to my tool belt every single year, making sure that I'm growing, I'm learning, my resume is increasing, so that if or when I want to move on to the next step, I'm better off each year. But that's something you sometimes have to do for yourself and make time out on your own time, on your own dime. And then I think the last thing I wanted to talk about is turnover. So sometimes in nonprofits and government, for the reasons I just said, people don't stay very long. So for me, I think throughout my entire career, the longest I've ever had a supervisor is about 1.5 years. And that's because they've left and found new opportunities, and suddenly I have a new supervisor who I have to introduce myself to, who has to learn that I'm reliable and skillful, and that'll cost you over time. Also, your team changes, and people that you really enjoyed working with, who really understood you, they'll leave for better opportunities, and you'll have to make those new relationships. So sometimes this can happen. Sometimes people stay and are happy in their nonprofit or government jobs, but I've found a lot of turnover, especially since the pandemic. Public health has really had a revolving door where people see the burnout, see the low compensation, and want better opportunities. So is public service worth it? This is really a personal question that, depending on what you're looking for, depending on what your ultimate dream job is, you really have to decide for yourself, is public service a good fit for me or not? The great thing, if you're concerned about loan forgiveness, is that your time does not have to be consecutive. So you can start in public service, decide, actually, no, you know what, I want to go work at a for-profit company, do that for a couple of years, come back, and you'll still have that time credited towards you. So feel free to explore and decide what's going to work best for you. Certainly for me, being that I was interested in epidemiology, most of that happens at a government level. And I was really interested in working on improving communities and working towards health equity. So I found roles in government that fit my values. There's other benefits of working in government, such as, because you're in a unionized environment, you're not going to be working overtime without getting paid. Some companies, will pressure you to work really long hours, and you get more protection. So this is really a personal question, and something I encourage you to explore. And don't be afraid to change your mind. Don't be afraid to explore different opportunities, and you can always come back. So that is the end of my presentation. You can follow me on Instagram or TikTok at The Joy of Student Loans, and I'm on LinkedIn as well.
Okay, I'm not sure what happened. Can you hear me, Joy?
Yes, I can.
Okay. I think someone else joined, so it kicked me out.
Oh no.
But no worries. Let me come back on camera. Okay. Can you see me?
Yes.
Okay, perfect. All right. So thank you so much, Joy. That was awesome. Personally, I, work in public service. And so hearing some of the pros and cons, I was over here like, yep, yes, I understand it. I feel it. I'm resonating with a lot of things that you're saying. So I wanted to definitely open the floor up for folks to ask you any questions, any comments or thoughts that they had. But to kind of kick us off, I had a question about, knowing that compensation and kind of negotiating your salary is not really something that you can do in public service, but it is something that you can do in some other sectors. What would be some other unique ways that you can add to your tool belt? You talked a little bit about trainings and conferences as some of the resources that are provided, but what about any leadership development opportunities or anything like that that you might recommend for folks to maybe explore?
So you can negotiate your salary in government. Some entities do not allow that, and they'll straight up tell you when you're hired, this is your starting salary, you're starting at the bottom, you have no room to negotiate. I have found, let's see, out of the 4 government entities I've worked at, I have been able to negotiate my salary at 3 of them. And I definitely recommend trying. I would say whatever they offer you, even if you're through the moon, so excited, say you want 10% more. They're not going to fire you. You're still going to be in the running. The worst that's going to happen is they're going to say, sorry, we can't do that. Or they'll come back 5% or, but definitely always try, because there is usually room. Very rarely they're going to offer you the very top. I can say I've never seen that happen, that they offer the very top to someone. It's usually a step or 2 down. Do your research. If it's a government position, there should be a listing of the pay scale. So you should know what that top is. So yeah, always do that.
Right.
But like you were saying, if the organization you're working at does not offer professional development opportunities, try to see if you can get some of your time at work to be allowed to, find a university that has a monthly webinar series that you're interested in learning more about. Even though maybe you can't physically attend a conference, some have either low cost or free virtual options, or they'll offer their slides, complete slides for every presentation afterwards, which you can get for free. So those are some ways that even though you can't physically attend a conference, you can still get that information. There's really great information on Coursera that can help build your toolkit. I know a lot of people in epidemiology are really interested in learning different coding, and there's great YouTube videos, TikToks talking about learning our programming language or Python. And then some of those are free, and you can ask your institution to download them, and you can play around in R on your work time to analyze data instead of using, for example, SAS, which is what we use. So be creative. Try to get your work time at least to have that investment back in yourself.
I love that. Invest back of your investment of working for them to invest back in you. I love that. I love that.
And when you're interviewing for a job, ask them, how are you going to help me advance and build my toolkit? They should have really firm answers of what's available. If they do not, that's a red flag, and you should consider, if that's a place you want to work.
Mm-hmm. That's great advice. That's great advice. I want to open the floor up to see if anybody else has any questions, comments for Joy. And if you can't think, you can also, if you don't want to come off mute, you can also write it in the chat box. And while folks are doing that, I have one more follow-up to that, Joy. So when we're talking about, we talked about public service loan forgiveness and how that can be really great. It's great to know that you don't have to consecutively use PSLF to be able to qualify for the 120 payments or the 10 years, so that you can have the option to come back and be flexible. What options or considerations should folks think about if they are considering public service and maybe public service loan forgiveness is not they're not qualified for PSLF at that public service organization? Are there any other avenues that they can explore if that entity is not recognized through PSLF?
So in public health, that's really our only option for loan forgiveness. Teachers have other options. People doing direct patient care, like doctors, nurse practitioners, have other options. But in public health, PSLF is really our only option for loan forgiveness.
Okay.
I will say that your payment plan probably has a forgiveness option. So the SAVE plan, don't quote me here, I think it's after 20 or 25 years, they'll forgive the remaining balance. But that's a really, really long time, right? To be
Yeah.
making those payments. So
Right. That is key. So thanks for adding that piece. Because I think some people might be confused, like, oh, maybe I don't do PSLF, maybe there's something else out there, but there is nothing else out there. So it's good to kind of know that going into maybe choosing a position or not. Because when you do have the higher salary, it is expected that you have a higher, payment, repayment option as well.
yes. And if you're in an income driven payment, they don't care if you have credit card debt. They don't care if you have medical debt. They don't care if you had to take, whatever your issues might be personally. They just care about how much money you received in the past year. And they
Mhm.
look at that, they look at 120 or 225% of the federal poverty level, and that's all that they care about. So it used to be that they took into consideration your total debt. So if you had medical bills or whatever, but they stopped doing that a while ago, 6, 7 years ago, I think.
Mhm. Okay. Well, thank you for that. Other questions, comments? Okay, I'll ask my last and final comment and question, Joy. If you had to summarize in one word or maybe one sentence, because one word is hard, of public service, what would it be if it is just like the why for you? And then for folks that weren't able to join today and that want to get in contact with you or learn more about public service and what you've gone through, or if they just have overarching questions, where can they go to reach you? And how can they connect with you and join your movement?
Yeah, totally. So to summarize my experience in public service, I would say rewarding but frustrating.
Mm,
And that is because I really believe in the work that I've done the past 10 years.
mhm,
It very much aligns with my core values and what I wanted to accomplish.
mhm,
But at the same time, being in public service is not easy. And there's lots of elements. Bureaucracy is just frustrating in general. And like I said, those development and also advancement opportunities and salary can be frustrating.
mhm, mhm. All right. So you heard it here first, folks. Like it is a frustrating process, but it is rewarding. Like there are some people who are out here fighting for our lives in terms of trying to promote health and wellness and well-being for the general public. And we do this work not because it's glamorous, sometimes not because it's compensated the best. It's because we really care about increasing the public's health and awareness and knowledge and changing behavior. So, sometimes there's pros and cons to that as well, but a lot of the reasons why we do this work is to see the change that we want to see in the world. So tell us how folks can stay in touch
Yes.
with you or get in contact.
So you can follow me on Instagram or TikTok at the Joy of Student Loans. You can also email me at thejoyofstudentloans@gmail.com. And I'm available at LinkedIn as well, Joy Jacobsen.
Thank you so much, Joy. And thank you to all of the folks that joined us virtually and those that will be watching this recording. They will also be accompanied with Joy's slides that she shared during the presentation today. And please feel free to follow her on all social networks and consider becoming a member of the NADrPH. We hope you enjoyed this webinar. Joy, thank you again for being with us for a second time in the same month. I know things have been so crazy this month, but we really appreciate you coming back a second time to spend some time with us talking about public service. And we hope you all have a great night. And thank you so much for joining. Thank you.
Thank you all.